Like you, I've heard the stories of medicinal cannabis radically changing people's lives. And it's often portrayed like a miracle cure. But how conclusive is the science behind the healing power of this plant? I'm on a mission to find out, and I'm starting by going back to university, the Australian Cannabis University, to be exact.
Hi, Laura.
Hey, Dolph, how you going? This is Dolph's Domain. It's a legal hemp farm where people from around Australia come to learn about the cannabis plant and sometimes eat it.
People try it every which way but loose. So we've got taking the plant, inserting it into different orifices, taking it orally, putting it on the soles of your feet. You know, there's a lot of concepts out there.
Dolph says hundreds of sick people have come here to heal themselves with cannabis. And whilst it's legal to grow low-grade cannabis under a hemp licence, using it for other stuff, well, it's a grey area.
You're not allowed to take the leaf off the farm, but eating it on the farm, there's no real legislation about that.
So you're taking on a bit of a risk, having people come here?
Yes. If I can help people, maybe I'll get some karma at the end of my life. Who knows? We have people with pain, car accidents, Crohn's disease, opioid addiction. They come here and they're having suicidal thoughts and they say, we want to get off opioids. I don't think there's nothing out there that cannabis can't help with. It's not a silver bullet, but it can help, and I think it's because of the nutrients in it.
Got people here juicing cannabis. Do you know how or why it works?
No, so we are a university in name only. It's a tongue-in-cheek thing.
Do you actually know how juicing cannabis helps you?
That's the thing, we still don't know so much about this plant because there's simply not enough research out there. There's not enough funding for this cause, especially raw cannabis medicine.
22-year-old Morgan Taylor has Crohn's disease, an autoimmune disease that causes her incredible pain. She spent her teen years in and out of hospital and tried 15 different types of prescription drugs, but the side effects were horrendous. She lost her hair, developed osteoporosis, and at one point was unable to walk.
The one that really sticks out is telling my parents that I don't want to live anymore. Yeah, that was really hard. Yeah, just looking my parents in the eye and telling them, like, you know, if I die, at least I'll be in a better place and I won't have to deal with the constant pain anymore and the fear of not knowing where my life is going to end up.
Thankfully, Morgan discovered juicing.
We have these cannabinoid receptors in our body, and the cannabis plant obviously has cannabinoids in it. When you're juicing cannabis, you can get thousands of milligrams of cannabinoids every day. So I think that's why I've responded to it so quickly, because I'm getting so much of the healing, you know, chemicals. It took really about a month for it to really start working, but once it did, I felt better than I had in a really long time, and I started working again and going out with my friends, and I felt, you know, normal again.
Whilst Morgan has found this legal loophole on Dolph's farm, last year her dad narrowly escaped jail time for growing weed to try and save her.
It wasn't taken lightly, but my parents were willing to do anything. I think anyone would do something for their child if they thought it worked.
Morgan is just one of many Australians going to extreme lengths to access cannabis outside of the legal system. But as success stories like hers have spread, more and more people are asking their doctors for this miracle drug. When medicinal cannabis was legalised in 2016, it was incredibly hard to get a prescription. But in the last 12 months, that's changed, with more than 4,000 prescriptions nationwide. But those tasked with prescribing it have been left in the dark, with more than half of all Australian GPs saying they don't know how to access it, and the vast majority saying they know very little about it. Luckily, some medical professionals have come to a real university in Sydney to learn more.
Today I stand before you as a warrior, a medical cannabis warrior.
I guess I don't really have enough information about it. I don't really know much. I guess that's why I came here tonight.
I have a lot of customers who have chronic pain And they've heard a lot about medicinal cannabis, so they want to be able to access it and they're not quite sure how to go about it.
Well, its use is still not completely understood, I think, and there has a little bit of community stigma.
Cannabis can help many symptoms associated with multiple sclerosis.
Until 3 years ago, Dr. Teresa Topic was a cannabis skeptic.
I used to believe that cannabis was just a drug of addiction. In fact, I used to think that it was marijuana, pot, a dangerous gateway drug and definitely to be avoided. I have absolutely no idea about medicinal properties of cannabis. In fact, I was really very ignorant.
Now she's prescribed it to more than 80 patients. Like many others, her conversion was inspired by the stories of its life-saving properties.
The suffering of the families feeling hopeless and helpless really affected me emotionally quite deeply. So I started reading and researching. I went online, I started Google this, Google that, went on YouTube.
For the conditions that you're actually getting prescriptions for at the moment, is there much evidence?
This is evidence happening as I am hands-on practicing with medicinal cannabis, but there's also so much evidence online.
There's really a lack of evidence over the effectiveness and safety of medical cannabis at this point in time. At this point, it does appear that studies are showing that for uncontrollable epilepsy in children, there might be a benefit. But for everything else, we are still waiting for good evidence to come through.
If GPs are prescribing medical cannabis, are they doing so without really knowing what it does?
A lot of what is happening with cannabis at the moment is based on what evidence there is out there, and some of it is not of very good quality.
There are several ongoing clinical trials for medical cannabis underway in Australia. The AMA says when it comes to legalisation, the cart was put before the horse.
Most medications which actually are out there have to go through a very rigorous trial process for very specific conditions. There still needs to be some good trials to evaluate the safety and effectiveness of cannabis.
A lot of doctors quote, there's not enough evidence, there's not enough proper randomized clinical trials. Look, in general, doctors tend to be conservative, which is a good thing, but sometimes we need to be a little bit courageous as well.
Is it sometimes a case of trial and error?
Well, trial and error is part of medicine. The most important part that we do it gently, judiciously, responsibly, do no harm.
How many people do you believe that you've treated and helped with cannabis over the years?
Directly hundreds over the years.
Do you believe that you have saved lives?
I don't need to have a belief in that. People have told me I've transformed their lives.
Andrew Catalaris, also known as Dr. Pot, has been providing cannabis oil to people since the 90s, way before medicinal cannabis was on the radar. It's seen him deregistered as a doctor, face court multiple times, and even go to jail. Whilst he believes that medicinal cannabis works for a range of conditions, including the treatment of cancer, he doesn't believe in clinical trials.
They're manipulated by the drug companies. The raw data is never released. They massage the facts and figures, right? There is no real testing.
So even if a clinical trial came out and said that cannabis wasn't working, you wouldn't believe those results?
I'm not interested in what other people do. What I'm interested in is what the patient's feedback is directly to me. And if 60% of the patients I interact with say that it's had a life-changing experience, right? Do I need further tests beyond that?
In fact, Dr. Catalaris conducts his own trials of experimental cannabis treatments, one of which was found by health authorities to be hasty, ill-conceived and unsafe, and lacking in scientific legitimacy. They believe he poses a risk to the health and safety of members of the public. In 2015, 2 women with ovarian cancer came to this wellness centre in Newcastle seeking an experimental cancer treatment. In a process they were assured was intrinsically safe, their abdomens were injected with coconut oil mixed with large doses of cannabis oil that they were unaware had not been tested. The injections landed both women in hospital with agonising gut pain and hallucinations, with some symptoms lasting for weeks. It also prevented one of them, known as Miss K, from having potentially life-saving chemotherapy.
Feeling pretty bummed about the whole cannabis oil experiment. Had almost 2 months with no chemo. That's allowed the cancer to go gangbusters again. I lost so much ground during that time. I very much want to live and will continue to fight the cancer.
Thanks for the update. I hope the next report's better health. Best wishes.
This was the last time Ms. K spoke to Andrew Catalaris. 2 months later, she died. Following their investigation, the HCCC reported this matter to the New South Wales Police, as they believe Catalaris' actions may have been criminal. Do you accept any responsibility in that?
For her death, the lady approached me in a terminal phase. She'd had 3 major bowel obstructions. No, I have no responsibility for her demise.
Some people believe that you put self-promotion and profit above the well-being of sick people. What do you say to that?
Profit? Profit? What profit was there? That trial cost us a fortune. I mean, the oil was donated, we paid for it.
You haven't profited from this work over the years?
No. Well, I've profited greatly in terms of my karma, I'd like to think.
Health authorities have banned you from supplying, administering or injecting cannabis to anyone in the community.
Who has?
The HCCC. Have you complied with that?
No, not at all.
Why?
Why should I? As I said, the HCCC are a failed organisation that are unable to properly assess facts in individual cases. Why would I adhere to those rulings? But you had to dig a little bit of shit on HCCC, didn't you? Like all the other fuckwits.
It's an official report
right?
that I need to
Is
seek.
it? Yeah.
So, what do you know about Andrew Catalaris?
I feel that he's a person of many facets. On one hand, he's very charismatic, highly intelligent, a pioneer who helped a lot of patients. But I also heard rumours.
So I want to show you a report and I'll give you time to read it. I gave Dr. Topic a copy of the report detailing Catalaris' actions.
I'm shocked. I thought it was just rumours. I didn't realize that this is a true story. The Hippocratic Oath is saying, primum non nocere, do no harm. As doctors, we can't play games with human life.
While the medical profession is seeking solid evidence that cannabis works, and others, like Dr. Catalaris, are going to dangerous lengths to prove it already does, patients like Morgan are caught in the middle. She can't wait for the science. She's trying to stay alive.
I'm just doing what I need to do to survive, and I would rather be illegally healed than legally dead.